The views expressed by our guests do not necessarily reflect that of the Rose, nor are they a substitute for medical advice provided by the listener's doctor.
How do healthcare challenges affect women in Texas, especially if you're a woman who works in the restaurant and the service industries? Dr. Laurie Choi joins the show to talk about the state of women's health and healthcare in Texas. She discusses some cold, hard facts about what happens to women when healthcare is not accessible, and why we should all be concerned. She's the founder of the organization I'll Have What She's Having, which continues to be a lifeline for women in the service industry, and she has some pretty strong views on what needs to change in order for women to have good health. When you subscribe to our show, you help us grow. Someone you know may need to hear this story. So please share with your family and friends, and consider supporting our mission. Your donation can help save the life of an uninsured woman. Let's talk about your breast. A different kind of podcast presented to you by The Rose, a breast center of excellence and a Texas treasure. You're going to hear frank discussions about tough topics, and you're going to learn why knowing about your breast could save your life. Laurie, thank you so much for being with us today.
Oh, Dorothy, it's always great to see you.
Oh, I tell you what, I'll Have What She's Having has just gone gangbusters ever since. How old is it now?
Well, we officially got started we got incorporated in 2018, but our first fundraiser was in October of 2017. So we're going on 7 years.
Wow. Now, I want you to tell our audience what I'll Have What She's Having is all about.
Okay. So I'm a physician, but my first job was waiting tables and then managing a restaurant. Then I went to medical school, married a chef. And so I moved to Texas, to Houston to train, and then have always been one foot, in the hospital and the other foot in the restaurants. I mean, food and beverage is a huge part of everyone who lives in Houston, I think. So back then, I was trying to be more supportive of my husband and his business, and thinking about how can we reduce his stress, how can I be a good partner, and one of the things that I thought of was, well, I'll just talk more to his employees, find out what, let them know that we're vested in them. And the more I spoke to the women, the more I realized that they worked like me in a male-dominated field. And we started to think about what would be ways that we could support women in being more successful in what they were doing. At the same time, there was a tremendous attack from the Texas legislature on women's health, on family planning. And the combination of those two things led us to create an organization which was going to do some pop-up dining to highlight women talent in food and beverage. And with each session, with each dinner, we would highlight an issue in women's health that we felt was that the public needed to be educated about. So over the years, we've gone from raising money and donating it to holding on to funds to support both men and women in food and beverage who were by and large uninsured. Right. So this is an incredibly hardworking bunch of people. Some of the people are working 2 or even 3 jobs and are still priced out of the health insurance market, right? So what we're trying to do is get every person who works in food and beverage, from food truck to fast food to fine dining, access to preventive medical care, mental health care, cancer screenings, and of course, when we talk about comprehensive reproductive health care, we want to be able to provide everything. So that means to me that someone would be able to access the birth control method of their choice. So for people who don't have insurance, things like a long-acting reversible contraception like an IUD or an implant cost somewhere between $800 and $2,000. So not feasible for someone who's most people. So we fund that. Also for people who are absolutely sure that they're done having kids, we pay for vasectomies, which we do through the generosity of urologists who donate their time to us. We also believe, as you know, that the Texas maternal mortality rate is embarrassing. I think right now, the most recent data shows that we've got the worst in the country.
Yeah, besides being so tragic, and how many lives are lost every year because
Exactly.
of the lack of
And
care.
when we look at that data, like what is the reason why people have death after bearing a child? Some of it is social. Some of it is there's a lot of people that we lose to suicide, homicide, or to even drug overdose. But a lot of it is that we're not supporting the family, the new family.
Mm-hmm.
So we are funding doula care for pregnant people. So if you are pregnant and you want to have a doula, someone who is going to coach you before you have a baby on the birthing process, coach you during labor, and then we provide that doula care for up to a year afterwards. We think this is the way that people should be supported in the very challenging process of being pregnant and starting a new family.
Absolutely.
The other thing is, when people are pregnant, over 50% of births in Texas are paid for by Medicaid. So most women won't have insurance. And once they become pregnant, they can sign up for Medicaid. But because that process is becoming more and more complicated, most people don't get that Medicaid in that first prenatal visit until the second or sometimes even the third trimester. So we really want to make sure that everyone who becomes pregnant who's in food and beverage contacts us. We'll expedite that sign up for Medicaid process, getting them in to see an OB, see them through their pregnancy, postpartum, and do everything that we can to help them make sure they have a healthy and successful pregnancy. And then the last other parts of comprehensive health care, we believe, is that a person who decides that they don't want to stay pregnant should have access to safe and legal abortion. Or there's a growing and really amazing bunch of resources out there for people who want to do self-managed abortion. That's medication abortion at home. And that is, we have to do a ton of credit and shout out to reproductive health care activists throughout the country, if not the world, who have put online resources which are just top-notch. I mean, if you want to have a medication abortion at home in any of the 50 states, the resources are available for you to do that. And people, it does seem kind of crazy to me, but this is the major difference between pre-Roe v. Wade and post-Roe v. Wade. Pre-Roe v. Wade, if a woman became pregnant and decided to terminate her pregnancy, that was really back alley abortion, mangling, things that were causing women to come into the ER with sepsis. And we aren't actually seeing that. There's a lot of unnecessary stress, trauma, and even maternal death that we're going to see as a result of abortion bans in Texas. But we're not going to see this, I don't think, those sorts of infections and deaths. So self-managed abortion is, what this refers to is that people who go online, do the research, order the pills, and take them, and essentially have an induced miscarriage at home. And the challenges of that, I think, are that a lot of people don't have tremendous health awareness. So the idea of asking someone to take a medication, which we know is going to cause severe cramping and bleeding, and ask them to go through that alone, seems pretty insane. Like, we would never ask any individual to manage such a major medical event in their life.
In a normal medical environment.
No. So what All Habits is Having is doing is our program is going to, if you're pregnant, we will get you in touch with someone who can tell you exactly how long you've been pregnant through ultrasound, and then talk you through all your options, all of the options that I've laid out here. And if they choose to pursue medication abortion and they have questions along the way that the online resources can't handle, some of which is online access to physicians, 24/7 access to care providers who can talk you through what you're going through. If they need something more, like they need another ultrasound, or if they should find that they have what's called an incomplete miscarriage at that time, you haven't fully expelled all the contents of pregnancy, and were to even need, which is extremely rare, a dilation and curettage procedure, we would be able to arrange for that. So it is.
So, Laurie, you're in some really sensitive areas here. And as a physician, you're not particularly, you're convinced this is the way we need to do these things.
For me, I think you can get caught up in politics and stories and drama, but the truth is we're talking about healthcare, which I believe truly belongs between a physician and his or her patient. Right. I believe that that's science. That's just common sense. And I really believe that for the most part, all the disagreements that we think that we have are mostly on a level of ignorance. I just think that most people will agree that we don't want women to die. We don't want women to, or pregnant people to die of hemorrhage. We don't want them to be suffering at home with the consequences of pregnancy. We want them to have, healthy pregnancy if they choose to be pregnant, and to avoid unplanned pregnancy. I think we can all agree that we want people to have choices, because we're a great state. I think we've just gotten a little bit distracted by politicians.
Well, and even what you're talking about with that prenatal and having someone there to walk you through all the different steps that you'll need. I mean, that's all healthcare. It's the healthcare we know we could have.
Yes.
And that's part of what
that was a huge part of what Texas offered in the past before the issue became politicized.
Right.
Everyone on both sides of the political aisle believed that it was important for family planning, for people to have access to choose when and how to have a family. And I think that those are things that deep down, studies show that most people do agree with that. So,
but it's not, and it's beyond just the maternal parts of it, because you've said before, healthcare in Texas for women is dire.
Yes.
And that includes every aspect of a woman's life.
Right.
I mean, we have so little resources left for women right now.
Right. And I mean, you're a huge champion for this cause. And I was thinking about it earlier, and just so that everyone is aware, I do consider you my mentor in this fight, because you've taught me more about resilience and how it's just continuing to fight. That's what's important. And you take the battles, and there will be a ton of setbacks, but what we're trying to do is one life at a time, right?
That's it.
So our partnership with you, I think, is just the perfect example of that. So in general, it's agreed that people should have annual mammograms starting from age 50, and then even some people
now age 40.
Exactly.
Yes.
So health insurance will pay for 40. But in our conversations, based on what you see more and more younger people presenting with breast cancer. So I'll have it. She's having funds age 35. And because we're not an insurance company,
you can do
a
that.
woman who's 35 can come and get an annual mammogram, and that'll be covered by us. And the truth is, what we try to encourage people, because you've seen people younger than 35.
Yes.
We don't want to have people hampered by the idea that, this isn't going to be paid for. It's like, if you have a breast problem, it needs to be investigated.
Yes.
And we would fund that. And that is just a matter of, what is the barrier? And sometimes we can't see the barrier. We think it's one thing, politicians, or it's payment, but it's something else. Sometimes it's fear.
But Laura, you've heard me say this before. Even when you have insurance, if you're a young woman, you're going to face all kind of barriers.
Exactly.
Because A, your doctor may or may not think that you're old enough for a mammogram. B, it will come out of your deductible, which can be extraordinarily high now.
Yes.
That's just the way it is. And so you're not going to spend that money on something that may or may not be a problem.
Right. Yes.
It's just, we just keep putting these barriers in front of women and saying, but be healthy.
Right. Exactly.
Eat right, do all that stuff. But the things that are going to keep you alive, like a mammogram and early detection, we don't make that possible.
There's a huge problem right now in healthcare in that we don't have enough people. That's from physicians to medical assistants. And then a lot of people in the pandemic retired. We lost a huge cadre of experienced nurses and physicians who retired early. And so now we have some new folks coming in, finish school, and they're in an environment where the relationship between patients and the healthcare entities is very antagonistic. You just can see that people are presenting later with their disease process. A lot of them have never been in the healthcare environment. And the acrimony that we see in almost every part of American life is also in the hospitals. I mean, I've had to speak to patients about the way they speak to nurses and nursing assistants. The politeness, the respect seems to be gone. And that will contribute to burnout and further worsen our healthcare crisis. So I think that every part of it does matter. So when we think about health insurance, and that previously was kind of the holy grail of what to do, I don't think it serves us anymore. A lot of people are paying in for something, but they can't afford a copay when they go to see a physician. They can't afford the deductible. So I think of that
Or
as
the physician's out of network, or you didn't have a referral, or the list goes on and on.
Yes.
And particularly right now, and I know you've listened to that Baker Institute recent report on the lack of primary care physicians and just how few physicians we really have.
Yes.
And it's
before
before
SB 8 and Roe reversal, there were already over half of Texas counties did not have an obstetrician.
Right.
So that is worsening because of the number of physicians who left during the pandemic. I heard a presentation the other day from one of the OBs who was quite well versed in the training process with American College of Obstetrics and Gynecology, and he notes that the average age of OBs in Texas is in their 50s, and they're not going to practice until their 70s and 80s. Mm-hmm. And the anticipation is by 2030, which is really just 5 years from now, there's going to be a shortage of over 800, I think his number was, of OBs. So we have already, have had for many years, maternal care deserts in parts of Texas. But I do think that is going to happen in our urban centers as well, especially in the lower income areas. I mean, the hospitals and care centers that provide care to lower income families.
Yeah.
So it's unfortunate that we're going to have to go through this crisis in order to get to the other side. And in the meantime, my plan is just to try to expand how many people we can help, just to completely bypass that system, bypass the gatekeeper of the primary care physician, and provide a standard of care, which honestly is only usually accessible to the very wealthiest. Something along the lines of a concierge MD model where people will call us and say, here's my issue, and we are going to just navigate them to the solution and also encourage them to do their annual preventive medical care visits. But I just don't think that the current system of going to a primary care doctor who can order some tests, bring them back in a couple of weeks, order some more tests. I mean, these are, unfortunately, we've been trained in an algorithm which favors procedures and testing, which will favor an individual's institution, but not necessarily the pocket of someone who's trying to stay
care.
Well and can't afford all of this care. So it's I am both daunted by what we're about to face, but also really positive in that I feel that I have a new ability now to really trust the women and the men who will come to us and say, this is my medical problem, and we don't have to say, we're going to funnel you into this currently existing system. We're just going to find solutions that work for those individuals.
Well, now, you're just one organization.
Yes.
Yes, and it could be a model for many, true, but you must have some lots of volunteers that help with this.
Well, I mean, we have great partners, right? You're a tremendous partner. I mean, it's and being able to say, okay, this enormous part of healthcare, which is breast health and early detection screening, is completely in your hands. And this is now 4 years that we've been doing mobile mammogram with the Rose. We're having one in early December. And we consistently always fill every spot. And I'm told by your navigators that we have one of the best attendance rates, which I'm very proud of. And we have a number of survivors in our group. And of course, those people are outspoken advocates for early detection, annual mammogram, and are living proof of what's
But still,
what's
your
important
team
about
works
that.
really hard to get people there. And that's not unusual anywhere.
Yes.
Anywhere. But I think it's got to be an extra effort from a service worker who may not have any control over their schedule, has, and that just makes it even harder.
But I think that, during my lifetime, I think there were things that we didn't talk about. We didn't talk about the fact that we needed to go to the doctor, or that we were having our period, or that we were going through menopause. And what I do think is nice about this current up generation and women of our age is just, we're now realizing that since all of us are going through these things and we are 50% of the U.S. population, we should just talk about it. I'm having my period, I'm going to take a day off because I'm having my period. Right. Or, yes, it's time for a mammogram. And we need to really engage men about having common knowledge about these things that 50% of the population have gone through. And I really think that the youth and social media are doing a really pretty good job about spreading that word.
I think they are too, but I think you hit the nail on the head because we are talking.
Yes.
That is the only thing I see different in these last 38 years of being at the Rose, is that now we're talking about it. I mean, we have better technology, we have better treatment, but at the end of the day, we don't have better health care. We don't have a better way of covering the people that are the most vulnerable or the lowest income. We really don't. So the fact that people are talking and saying this is okay to talk about and this is what you need to do. I am still amazed at the myths that are out there about breast cancer as they are out there on every single illness you could have with so much awareness. But it's kind of like you said, if you're not in that world, you're not going to know.
Right. What I learned in the last year and a half or so is that if you grew up in Texas and you went to public school, the health education that you get is not that great. Until recently, sex ed was abstinence-only education. Right. So I can't speak to it because I didn't grow up here, but I think that I got pretty good health education. And of course, living with my dad was a physician, my mom was a retired nurse. That being around people who have health awareness just makes you more health aware.
Right.
So let's suppose you graduate from high school, then you go straight into your job as a waiter or bartender. And from then on, you are only getting your health care when you get sick and you go to the ER. Versus you and I, who go to the doctor every year, and we hear this spiel every year from our doctor. Yeah. Are you taking your vitamins? Are you wearing your seatbelt? Are you smoking? Are you walking? I mean, and that that message does seep through, right? And so I find that what we're having to overcome in trying to improve the health awareness of food and beverage workers is realizing that they're completely unfamiliar with this process of going to the doctor, sitting, getting asked this interview, the slew of questions about head to toe, what we call the review of systems, and the rhythm of it. And so that lack of familiarity generates, I think, some fear. And then they don't really want to go. They don't want to engage. And so I think that we just need to try to start meeting people where they're at. Our director of outreach and head healthcare ambassador, Lindsay Ray Burleson, is a bar owner. And it's just an amazing level of emotional intelligence and able to detect barriers that I learned nothing about in a now many years of dealing with underserved populations, just not realizing what people think is a barrier. I've heard that they're not comfortable going to a doctor's office because they feel like with all these tattoos and piercings, maybe they'll be discriminated against. And that just never would have occurred to me.
They may not, some of the questions even on the input sheet, on that patient information sheet. I mean, really, if you're never aware of any of this stuff, it's like, oh my gosh, what they just asked me.
Yes. Yeah. There's a lot of barriers there that we're not sensitive to because we're used to being in this environment. Right. And so I'm appreciative of all the candor that we get from the food and beverage workers that we get in contact with. And that kind of feedback, I think, can only make us better.
So you really do get a lot of feedback. They tell you what
we look for
they
it.
need.
We ask them. We've had a couple of times where we've put out surveys and asked for interviews for them to tell us what their feelings are. And, I think that telehealth, which we can't really have in Texas unless the formal telehealth through an insurance company has a lot of restrictions. But just like if your car broke down, you'd call a friend and ask them which mechanic or, we would ask a friend. Let's ask a friend what they think is going on. That's kind of where we want to be. You're having an issue. You want to talk about it. We want to have peer counselors who are available to say, hey, listen, well, I've been to this physician through the group, and I think she's really great. She's someone that we that you want to go talk to. Mental health care, we've made a tremendous a number of advances in that. And people are showing up to group therapy that never, ever, ever thought they would go, because it's not so much group therapy as it's peer support and talking about the stresses that they've been through. Mm-hmm. The food and beverage industry has just lost disproportionately people to suicide and drug overdose over the years, and I have been watching this happen since All Have When She's Seven got started, and I've never been so hopeful, because I think that we're finding individuals who are mourning those losses take that and turn it into activism in which they want to participate in these programs and spread the word about these programs to make sure that we don't lose anyone else. And those are some of the volunteers that I think are really driving that program forward.
That's so interesting. I mean, just hearing you say I'm hopeful.
Yes.
Yes.
I think that we, as you know, women are just incredibly resourceful. Mm-hmm. So I think that the more we listen and just listens, because I'll sometimes I'm only half listening, and then later I'll say, what did she say? And then just go back and act on that statement. Like I was really preoccupied with financials one day, and Lindsay Ray said to me, well, I mean, our essence is, are we connecting people to care? So, I really think that maybe we need to spend a little bit of time on that. And I was like, yeah, I'll get to that. And then 30 minutes later I said, well, that's right. Our mission is to connect people to care. So let's put the math on the shelf for a second and get back to the mission. Are we connecting those people? Right. And right now, I think our biggest challenge is we have, I think, great word of mouth in some of the upper echelons of Houston food and beverage, but what we really want to do is make that connection to the Houston food trucks and every Whataburger employee in the state and fast food workers.
Because anyone can call you.
Anyone can call us, yes. And that's really, I think that lower income group is the ones who can most benefit from what we have to offer. Mm-hmm. And that's the connection that we're looking to make. So if there are Whataburger makers out there, thank you so much for what you do, because we do love Whataburger. Please call us if you need a preventive medical care or mental health care. We'd love to connect you.
Whatever it is.
Whatever it is, yes.
So let me have just a couple of more questions. One of the times that we were going through a really tough time, especially during COVID, and I heard you say it's always the women that have to make the decisions, take it on the chin. I thought, I had never really put that descriptor with women, and I thought that's exactly what happens.
It's so true.
Speak to that for just a bit.
I think the women are just, and it's just their natural, the resourcefulness, their caregiving. So a lot of them have grown up, being like the responsible kid and babysat and were leaned on by their parents. And then, so now I think a lot of women of childbearing age, their parents are also older, right? Mm-hmm. So they're stuck and they're doing both the child rearing, which and also with the caregiving of a parent who's getting older. And the data is going to show us, well, before the pandemic, Houston had resources, regardless of your income, to provide 40% of the child care needs. So unfortunately, I don't really think that's it's not better to the point where women are going to be off the hook for child care. No. And certainly we know that our population is getting older. Rates of dementia, unfortunately, are increasing, and that burden of caring for that parent or elderly relative, it also is falling on women. So that level of stress. I've been through a little bit of that with my own parents, and it's just made me incredibly aware of how we're just not really ready. We're not ready as a society for the aging of our population. And that burden of raising your children, but also taking care of your elderly parents, and then seeing your friends going through all the same thing. It's just a stress level that I don't think that we're all mentally prepared for. So that is something. Or
even realize we're in the middle of all that.
Yes.
Yeah, and what it's doing to us.
Yes, I think that the society that we are, in which we really want to treat people with respect and care, and dignity throughout their lives, this is going to be a tremendous challenge for us. And I think that, that's something I've got a real interest in right now, because I believe that women at the prime of their career are going to be asked to take on this responsibility. And unless you are really, really wealthy, the resources are just not going to be there, because sometimes, depending on what the medical problem is, a person's going to need 24-hour care.
Right.
And
so that woman's going to have to make that decision on what she's able to do or not able to do.
Yes.
Yeah.
So my mom broke her leg earlier in the summer, and I just saw the entire thing flash before my eyes, because she lives in the same city as my sister, who is a incredibly wonderful executive and travels extensively for her job. And I'm so proud of her. And I said to her, okay, we can't let this set you back. On the other hand, we can't let our mom fall again. And so I had my serious physician paranoia on, and I said, these are the steps that we're going to take. And we're fortunate that we have, supportive brothers and means, and knock on wood, my mom has not fallen again. And this is what we have to do. We have to really be proactive in thinking, how are we going to help our parents and elderly relatives have a great,
rest of their life.
Yes, and provide them with independence and great quality of life, and still have a career and be able to care for our family, because a lot of families can't even afford to have someone leave the workforce like that. So these are going to be huge challenges, and that is something that I want us to be able to focus on. If you're facing this as a restaurant worker, or you have someone, when someone ends up in an emergency room and ends up admitted to the hospital, this usually overtakes your life for several weeks.
Right.
So we kind of want to help people navigate that as well, because that one, I feel like we are all out there reinventing the wheel.
Yes.
Your family member gets admitted to the hospital, and then dealing with all of that is just an incredibly chaotic time.
Yes.
So we kind of want to look at how we can help navigate that part as well.
So I'll Have What She's Having is addressing many, many different issues.
Yes.
And how do we find you?
So we're at allhavewhatshe'shaving.org. We're on Instagram, TikTok, Facebook, LinkedIn. Please reach out. We're here to make better health and hospitality, and that's no matter what.
No matter what. Doing a great, great job at it.
So thank you for your help in that.
Thank you for joining us today on Let's Talk About Your Breasts. This podcast is produced by Speak Podcasting and brought to you by The Rose. Visit therose.org to learn more about our organization. Subscribe to our podcast, share episodes with friends, and join the conversation on social media using hashtag Let's Talk About Your Breasts. We welcome your feedback and suggestions. Consider supporting The Rose. Your gift can make the difference to a person in need. And remember, self-care is not selfish. It's essential.